Hey, what's up? My name is Daniel Gravino, and this is going to be my first case study on blood banking, anti-C, little c IgM, an uncommonly observed but expected phenomenon. So, what is anti-C or anti-C antigen, or little c? It's a part of the Rh blood group system and is found in approximately 80% of the United States population. Anti-C antibody develops in individuals synthesized through the previous exposure and is associated with acute and delayed hemolytic transfusion reaction as well as hemolytic disease of the newborn. Most antibodies produced against Rh antigens are of the immunoglobulin G. We present a case of anti-C in a 30-year-old white woman who was gravida or G2P1, whose laboratory work at the same time of admission for delivery suggests recent exposure of seroconversion in the latter part of her pregnancy, with evidence of the expected but rarely demonstrated presence of anti-C IgM and IgG. So, the case is a 30-year-old white woman with G2P1 was admitted for labor and approximately 39 weeks and 6 days of her pregnancy. So her history was there were no was unremarkable and no history of rare blood transfusion. So her first pregnancy 2 years previously had progressed normally. She had experienced spontaneous vaginal delivery. However, manual placenta extraction was required. And then her laboratory hemoglobin level of 11.2 grams per deciliter and hematocrit of 33.4%. Her blood workup, she is a positive A blood type and positive via antibody screening with two of three cells showing 3 plus and 4 plus reactivity. Results of the antibody panel showed an anti-C antibody reacting with all three phases of tube testing. With a negative autocontrol, the patient's phenotype was negative for the C antigen. So there was an additional test. Cells excluded antibodies to NJK and FYA. So these are her results or the table. So that's her result. And direct immunoglobulin test on the blood of the neonate, and it was negative and positive for C. So that's it. So discussion. So the discussion is the Rh blood group system is one of the most complex blood group identified in highly pleomorphic and immunogenic, second to the ABO group. It is the most clinically significant in transfusion medicine. So, the Rh system is one of the most immunogenic blood groups in the human, and as well is world hemolytic disease of the newborn, in which mothers in Rh negativity are synthesized to the D antigen during her first Rh positive pregnancy or exposure to Rh positive blood and subsequently mount a severe immune response to the D antigen during her subsequent Rh positive pregnancy, producing hemolytic reaction that is life-threatening to the fetus. The alloantibodies produced are primarily Ig and react optimally at warm temperatures with obvious clinical significance. So the little c, which is found approximately 80% in women and is associated with severe HDN. So antibodies arise through the previous exposure such as fetal-maternal hemorrhage or transfusion and can be produced acute and delayed hemolytic reactions. So during an initial pregnancy and complications occur with repeat exposure during subsequent pregnancies. So they are similar to the Rh antibodies. Anti-C is also primarily of the IgG type. IgM anti-C, however, has been reported as well as other Rh IgM, as IgM antibodies are the the first immunoglobulins to be produced during a humoral immune response, followed by IgG. It is not unexpected that the process of sensitization or seroconversion after C antigen exposure involves the same course of anti-C IgM production before anti-C IgG is formed. So, laboratory workup provides evidence supportive of the mother with Rh positivity. So, observe with the immediate spin phase of tube testing the antibody titer. The negative DAT results of the neonate indicate that IgA levels are not too high enough, such as crossing placenta with early phase. So, the pattern of reactivity and maternal fetal phenotypes were most consistent with the anti-C antibody. The reason for the underlying fetal-maternal hemorrhage remains undefined. However, leakage of the fetal red blood cell into the maternal circulation can occur late in pregnancy, although we use tube testing in this instance. So it would not be usually to also encounter difficulty detecting an IgM anti-C antibody using gel technology. However, the sensitivity of the antibody detection with gels is reportedly higher. So it's higher, the sensitivity of this test. So management of the pregnant women and girls who harbor an anti-C entity is not currently defined. However, the conditions of such patients are often managed in a manner similar to that of for individuals who harbor anti-D antibodies. So hence, synthesized mothers requiring transfusion should be given Rh positive blood due to scarcity of Rh negative units that are C antigen negative. So in summary, this case demonstrates the formation of anti-C IgM IgG in a pregnant 30-year-old white woman, which we discovered as labor commenced. Fetal maternal hemorrhage was unlikely cause for the sensation. Complications associated with the antibody did not occur. This case may be educational interest for blood bank physicians and healthcare professionals alike, and highlights the importance of antibody screening in pregnant women and girls who are approaching delivery. So thank you for listening.